Hi, my name is Amanda Parmalee, and I'm a family nurse practitioner with Hampton Roads Community Health Center, and I'm here to talk to you today about diabetes. Diabetes is a disorder that has to do with sugar. So hence the picture of the sugar blocks up here. So a lot of people have heard of diabetes, and a lot of people don't understand exactly what it is, how it works, the different types, and I'm just here to clarify some of those questions today. So diabetes, the basics of diabetes is that when we eat, some of the food that we eat is broken down into sugar. There's other parts of the food, pieces of protein, things like that, that are broken down, but not into sugar. Sugar is also called glucose when it gets broken down. This sugar travels in the blood to all of the body cells, and the way that it gets into the body cells to provide the body with energy is that it meets up with insulin. Together with insulin, the sugar is able to move into the cell and provide the cell energy. So insulin sort of acts like a key, if you will, to allow the sugar to get into the cell. Without the insulin, then the sugar is not going to get into the cell, and the sugar is going to stay out in the bloodstream where it really doesn't serve a purpose. So insulin is its own sort of enzyme, if you will. And where does it come from, you might be asking. So I've included here a picture of the pancreas. So we have the liver, which is located on the right side of the abdomen, and then you have the stomach kind of off to the left, and then the pancreas is right around that area, and that is where the insulin is made from. There are cells in the pancreas, they are called beta cells, and they actually make insulin. So you may wonder, you may have heard of type 1 diabetes versus type 2 diabetes. And what is the difference in type 1 diabetes and type 2 diabetes? We're predominantly talking today about type 2 diabetes, not about type 1, but I thought I would explain the difference between the two. Type 1 diabetes is usually occurs in childhood, usually before or even in young adults, typically below the age of 40. It is a destruction of those beta cells in the pancreas that I just mentioned. And the beta cells don't work at all, and so they don't produce any insulin at all. So those people, type 1 diabetics, will forever be relying on insulin. They can't take any pills or anything else, and they will be forever relying on insulin. And that is not a very common version of diabetes. So that's not typically something that you see. We're more focused, like I said, on the type 2 diabetes because that is modifiable. That is a gradual increase in insulin resistance. So the body actually doesn't listen to the insulin anymore, and it doesn't pay attention. So you get this gradual increase in blood sugars, and it doesn't respond. And so a lot of times with type 2 diabetes, you might hear a phrase called insulin resistance or decreased insulin sensitivity. And that's kind of what we're talking about in terms of type 2 diabetes and lifestyle. What are the risk factors for diabetes? So gender, unfortunately, is a predictor of diabetes. More males get diabetes than females, not to say that females don't get it, but it is predominantly more in males. People that are inactive will have a higher incidence of diabetes than diabetes type 2 than those who are active, because exercise actually increases insulin sensitivity, going back to that whole concept. Weight. Being overweight or being obese can actually increase your risk for diabetes because a lot of cellulite or adipose tissue will actually store more sugar, and it can predispose you to a higher blood sugar level. Family history. If you have a strong family history of diabetes, mom had diabetes, dad had diabetes, siblings, aunts, uncles, then you would want to kind of keep that on your radar that you might be at a higher risk for diabetes as well.
blood pressure. So blood pressure, having a higher than normal blood pressure can be an indicator that you might want to get screened for diabetes. Typically, a higher than normal blood pressure can correspond to kind of maybe a less healthy lifestyle. So that can be an indicator that you would want to kind of keep an eye out on that. And then age. 40 to 45 is the age, and up is the age where we start thinking about screening people more for diabetes. We find that more people above those ages are diagnosed with diabetes, although that statistic may be changing a little bit, but historically, like I said, greater than 40 to 45. So what are the symptoms of diabetes? So the most common symptoms of diabetes, and some people may not have any symptoms of diabetes because it is a slow, gradual increase in blood sugar that can occur over years. You may not even notice. So some things that you might see though are being very, very thirsty, and subsequent episodes of going to the bathroom a lot, or urinating a lot, or should be kind of a red flag. Feeling very hungry, even though you're eating, you're just constantly hungry. A lot of fatigue, going back to that whole blood sugar and the sugar not being able to get into the cell because of the insulin resistance or decreased sensitivity, that can contribute to this feeling of fatigue because the cells, like I said, aren't getting the energy from the sugar that they need to get. Blurry vision. Now, high blood sugars can damage the very tiny blood vessels in the back of the eye, and that can contribute to blurry vision. Cuts and bruises that are slow to heal. Now, once again, the tiny vessels that are in the back of the eye are also in fingertips and also in legs and arms. And if those tiny blood vessels are sort of pounded with a lot of blood sugar, that can actually impair the wound healing process. And then kind of going back to type 1, just an FYI, weight loss, even though you're eating more, that's more of a type 1 type thing, so I kind of say that with a grain of salt. But type 2, back to the type 2, tingling, pain, or numbness in the hands or feet would also be another thing to watch out for, because that goes back to damage to tiny blood vessels in the fingertips and the toes, and that can also damage nerves. So it's that nerve damage causing what you might have heard of as neuropathy, and that can also be a sign of type 2 diabetes. How do we treat diabetes? So depending on what your blood sugar level is, you come in, you may be told, you may hear somebody be told that they have pre-diabetes, which is kind of the beginning stages of diabetes, not diagnostic of diabetes, so not necessarily something that we would even want to start with medication, but just kind of keeping an eye out on it. That is a great stage to start a lot of intensive lifestyle interventions. So when I say lifestyle interventions, I mean exercise. I mean watching your diet. So what kind of diet and exercise changes do we make? So there's 4 different kinds of exercise. There's continuous exercise, and that exercise is just moving around a lot during the day. So you might just walk around a lot with your job, or park the car out further away when you're going to the grocery store and walk in, or take the stairs. Just keeping moving consistently throughout the day. There is stretching. That can be an exercise. So that's performing like calisthenics, stretches, yoga, that kind of thing. That's actually good for toning the muscles and lengthening them and helping with flexibility. There's strength training. So that's going to be weight, like lifting weights, that kind of thing. Walking with low intensity weights could be another way that you can kind of work on strength training. And then there's the most important part, which is the aerobic exercise. When I say aerobic exercise, I mean getting your heart rate up and sustaining that heart rate for anywhere from, with a goal of 150 minutes a week. So you can split that up into 10-minute sessions 3 times a day for 5 days a week. You could do 15-15, you could do a full 30. It doesn't necessarily have to be all at one time, but aiming for 150 minutes of aerobic exercise a week. Aerobic meaning it's increasing your oxygen consumption, you're becoming out of breath to a certain point, and you're getting that heart rate up and going. That's what's going to lower your cholesterol. That's what's going to increase your good numbers and decrease your blood sugar, thereby decreasing your risk for diabetes and decreasing any comorbidities that could come around from diabetes. In terms of diet, what are things that you would want to think about with diet? And you could talk about diet all day long. There's a whole field of dietitians that only talk about diet. But to sum it up in a nutshell, what you could think of is I like to talk about the plate and what you should be putting on your plate. When you eat, half of your plate should be fruits and vegetables. Not canned vegetables, but fresh fruit, fresh vegetables, or fresh frozen fruit and vegetables. And you should be getting a variety of colors with your fruits and vegetables. So yellow squash, green peppers, broccoli, red peppers, dark greens like spinach and kale. And a quarter of your plate can be a protein. So we would want to go with something like a lean protein, like a fish or a chicken with no skin, or you could even do some meatless meals. So you could focus on beans, eggs. Quinoa is another source of a protein, but that can be considered a grain. But it doesn't hurt anyone to do some meatless meals because meat can be high in cholesterol. And then you would want to do the final quarter of your plate as a whole grain. So you want to stay away from the refined carbohydrates. You want to stay away from the white breads, the white pastas, and only sort of keep those for special occasions, a piece of cake at a birthday party or something like that. But something like whole wheat pasta or brown rice, something like that. And you want to keep it to about a half to 3/4 of a cup. And it should be it should be about the size of the palm of your hand and no thicker than a deck of cards in terms of your grain consumption. And really, fruit juices and sodas, they taste great, but they don't have a lot of nutritional value. So more water, less fruit juices, and really trying to eliminate sodas would help improve blood sugar as well. Another way to treat diabetes, if you do kind of get into that area where you need medications, we can treat type 2 diabetes with pills. There are a lot of pills available in the market, and each pill works in a different way, and so that would be something that you would want to talk to your provider about, because and I would recommend understanding the way that your blood sugar medicine works, because that can let you know exactly how to take it and the best ways that it can work for you. And then of course insulin. And insulin can work with the blood pressure or the blood sugar pills, or you can take insulin by itself. So what happens if you don't treat diabetes? So let's talk about the side effects of diabetes. So untreated diabetes can be a very systemic thing. And when I say systemic, I mean it can work its way throughout the body. And we'll just kind of start at the top. So untreated diabetes can increase your risk for stroke. It has been associated with damage to the blood vessels in the brain. We mentioned the eyes. Untreated diabetes can destroy the blood vessels in the back of the eye and can increase your risk for blindness. Then you think about the heart. Once again, just like with stroke, diabetes increases your risk for heart attack and the blood vessels that are surrounding the heart. So it's important to stay on top of your diabetes or your blood sugar in order to minimize risk of stroke and heart attack. It also can increase your risk for stomach damage and stomach pain. Untreated diabetes can cause something called gastroparesis, and that is an impairment with which the way the digestive system functions and causes a lot of stomach pain. So you would always want to get that checked out, but that's just one other thing that can happen. Then you think about the reproductive system. Untreated diabetes can increase your risk for infertility. It can increase your risk, and I know most people have heard about someone with untreated diabetes that has gotten a limb amputated or a toe amputated. It can cause permanent damage to the tiny blood vessels in the toes and in the foot and in the leg, increasing your risk for amputation. And kind of a precursor, a warning for that would be that peripheral neuropathy type pain that we are talking about. We have medications that can treat all of these things, but the best way to treat it is to try to keep your blood sugar under control, because when it's hard to treat it from a standpoint where we're trying to correct damage that has already occurred. The best way is to prevent the damage from happening in the first place. And how to lower your risk of diabetes. So obviously, we've talked about diet and exercise. So exercising regularly, shooting for that 150 minutes of weekly aerobic exercise, eating a healthy diet. So considering the plate method, half of your plate being fruits and vegetables, 1/4 lean protein, 1/4 whole grains, if you're going to do grains. Keeping a healthy BMI, and a BMI stands for body mass index. And that is something that you can find online. You could just do an internet search for a BMI calculator. It will ask you for your weight, it will ask you for your height, and it will ask you for your gender. And you put those numbers in and it will give you spit out a number, a calculation. A healthy BMI is 25 or less. Between 26 and 30 is overweight, and 31 and up is obese. So we're shooting for 25, but if you're in any of those overweight or obese categories, any weight loss that you can manage to cause would be helpful. You should follow up regularly for your doctor or with your doctor appointments as recommended, because your doctor will guide you towards the screenings that you should be having. We can let you know if you needed to be screened for diabetes and how often you needed to be screened for diabetes. We check your cholesterol. And then that can be an indicator of uncontrolled blood sugar as well. We check your kidney function and your liver function, and those are all things that can be affected by untreated diabetes. And then, of course, taking all of your medications as prescribed. And if you have side effects of medications, talk about that with your doctor before you make any changes. It's never healthy to just stop taking something because the side effects of the ailment for which you were taking the medications may be more serious than the side effects of the medications. So, and there's usually alternatives that we can prescribe that may have less detrimental side effects, so you could be able to tolerate that medication better. And that's it. Thank you very much.